The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Christine's struggle with cancer. Seven-year-old Christine lives in Manitoba and has been battling neuroblastoma, a cancer that spread throughout her body, for the past 3 years. She has already endured radiation, 9 rounds of chemotherapy, and a bone marrow transplant. Now doctors have discovered a tumor attached to her vena cava, the major vein that brings blood to the heart from the lower body.
Watch. Remember when you did the MRI and you threw that ball that had the little piece of metal in it and it just flew up into the machine? Okay, you got metal pieces in your watch and that'll fly right off your hand.
Today, Christine will have an MRI to determine if surgery to remove the tumor is possible. The surgery would be extremely risky, but could be Christine's best chance for survival.
Okay, sweetie.
Have a smell of that?
Cover it up.
The smell of bubblegum.
Smells good, huh?
We put it on the mask.
Is it on?
Yeah, I'll put some on. You might want to put a bit more on this like it.
Very nervous? You okay?
Okay, sweetie, here's the bubble gum mask, okay? Goes over your nose like that.
So you can
There you go. Well done.
Sorry?
You can see it quite well on this.
So I'm not sure what this full white area there is. I'm not sure if it can be a calcification or something. Sorry.
That's it.
Yeah. All this looks like it, all this area here. Okay, we're done for the abdomen.
No.
I was sleeping so hard I couldn't really sleep.
Well, that's why we gave you the bubblegum mask, so that you didn't have to lie there. Your eyes were open, but you were out.
Why wasn't?
Yes, you were. You had a goofy grin on your face, too.
Do you want to try and sit up?
Hey, you're not ready to sit up yet. Lie back. Did I make you dizzy? No? Okay.
So, just to review, this is a 7-year-old girl with stage 4 neuroblastoma who's gotten all therapy you can imagine and has now been felt to have limited disease just in her abdomen. She's had multiple stents put in the right kidney for hydronephrosis, and functionally that right kidney is not doing very much. It only has about 14% of her 14% function.
So we'll set up a mass in the right suprarenal region.
And is that vena cava here?
Yeah, that's vena cava.
Could you tell me about the? Do you think is there anything in the liver that look funny at all? I know you haven't reviewed these before, but
There's something hyperdense in there. It's here as well.
it's kind of roughly where the MR, I think, as I recall, demonstrated something.
What's
there at all.
unusual about it is that it's hyperdense even before contrast.
So it suggests it's calcified, or it's
I think, I mean, it could be a calcified metastasis. But it's not typical for neuroblastoma.
The tumor certainly looks like, I mean, it's where it was before, but the important thing to me is where it is with respect to the vessels. It certainly seems to be attached to the inferior vena cava, but as best as we can tell, it's not wrapping around it, so it's stuck to it on one side. This is the vena cava here, and this is the tumor coming up to it. So it appears to be pretty much stuck back here. I mean, just the nature of it, I mean, it's absolutely, this kind of underplays, it actually is welded to the vertebral body. The getting it out part will be difficult. All honestly, you can never tell a parent that you're going to get it all out.
Yeah. If there's a possibility to remove it, I would be happy. Just to know that it's gone, type of thing.
Okay.
The tumor that is right up around the vein, is that still live or?
Well, you actually bring up a very good point. And that's the biggest problem with the stage 4 children with neuroblastoma. We hope that the active tumor is more central within this mass, and that gives us some degree of play to leave fragments that are left, because we can't sacrifice any of those vessels in terms of function. It just, you need all of them. And what we will probably end up doing is present Christine at one of our, we have a tumor board here, and present her there with the information on the liver lesion, the ultrasound results, and give you kind of, instead of just my opinion, you'll get more of a consensus opinion.
There. Okay, just wait. Let's get the luggage. Okay. Go on.
What are you guys doing?
Checking out the little ants. The people that look like ants. Want to see? What time does Beanhead got to be at the hospital?
Between 12 and 1, like right now.
Oh, man.
We better go. You guys can go to the hospital then, and we'll
Okay,
get the
I need
luggage.
my briefcase.
Okay.
My briefcase tells me where to go. Never
We're going
mind.
to
We'll
get it
find
right
it.
now.
You know what? We'll just find it. It's okay. We'll just go up to the information.
She's got to go to the hospital right now, eh?
Yeah.
Oh, she starts preps today.
I don't step on my foot. Hey, you want to take Mason on the other hand? How you doing, buddy? Okay.
Not nervous?
Not that much.
Don't be. Piece of cake, kiddo.
This is a walk in the park for you. All of the hard stuff is done by me and Mom. We got to sit there and wait for them to say it's done.
Okay. Oh, look, your name's on the board. How long did it take you to get to the hospital from the airport?
We went to the hotel.
Oh, you went to the hotel first.
Yeah, and the hotel's like down the street this way and then across the road.
Oh, yeah, so it's not too far. Oh, very good.
Just want to review everything with you one more time. We're going to try and take out the tumor primarily without taking out any piece of her inferior vena cava.
Okay.
Okay.
And the right kidney's going?
Yeah, the right kidney's going to come out with the resection, and then we'll take a small resection of the lump. And I don't know what that is because it doesn't have the right characteristics on the
Yeah, that's what they
contrast
said
study.
in Calgary.
So it doesn't fit, but again, you shouldn't have any lumps in your liver. I was telling my husband we would put the whole day aside. Hopefully we won't need it, but if we do, we have it all.
Okay. Do you know approximately how long?
Well, we put aside till 3:30.
Okay.
So if it's going to go beyond 3:30, I'll call out and let you know where we're at.
Okay.
And if it's sooner, great.
Yeah.
Yeah. The only reason I put more time, I just think it's going to be really stuck, and I just think it's going to just take. It's going to be rather slow, tedious, just getting it all up. So.
As long as we get it all.
Yeah, for sure. That's the
Right.
plan.
All right.
We'll see you in a few minutes.
Okay.
Jumping Jiminy, you're
Are you cold now?
Yes, the bed's cold.
That's cool. Well.
Hi.
Hello.
Hi there, this is Christine, is that right?
Yes.
Hi Christine. Hi, I'm Dr. Evans, I'm one of the anaesthetists here. Alright, so I'm the doctor who send you off to sleep and look after you while we do the operation. Alright? Have you ever had any operations before? You had one quite recently, did you? How was that? How was the sleep? Was it all right? You didn't remember anything about it? Are you sleepy now? You're yawning there, aren't you?
I woke up a little while ago.
Oh dear, so did I. Okay, and because you've already got the IV in, what we're going to do is just give some medicine through the IV, through this tubing, and that will drift you off to sleep. Okay? Well, if you want a mask, we can give you a little mask to breathe. We can make it fruit flavoured if you've got...
Do you want a mask?
It's up to you.
Yes, please.
Yeah, okay, well we can do a little bit of both. You can have the mask to breathe. What was the favourite flavour? We've got orange, watermelon, strawberry, bubblegum.
Bubblegum.
You like bubblegum? All right, we'll have bubblegum then. Have you got any questions? No?
Are you ready for this?
Pretty cool.
Okay, this is the consent form for Christine, just read through it. Resection of intradermal tumor, resection of right kidney, resection of liver mass, possible inferior vena cava repair. So I say we'll give you some updates as we're going along, and we'll take very good care of her, and we'll see you at the end of the day.
Awesome.
Okay, good. See you later. Yep.
Good luck.
Yep, thank you.
Hope so.
This is Gallon.
Is it the gown? Did they spell your name right?
Yep.
Christina, are you going to bring your bear in? Is that-
There. Yeah.
There?
Is this the end of the line for us, or?
No, you guys can, we can go towards the doors. See you later, Mom.
Hey, whoa, kisses here, buddy.
Hey, you be good in there.
Good dreams, babe.
We need to prep out the leg so we can get at her saphenous vein. So in case we need to patch her IVC, we have to have some vein to have access to. I think we have to go across at least because I want to get the liver all mobilized up because there's a lesion in the right upper lobe, almost the diaphragm here that we need to see. So we need to mobilize that. And I think we need to get control of the cava because I think as we try to peel it off, we're going to be making holes in it. Say when on here. Ready? Okay. There's quite a bit of scar tissue here. We're not even close to where we need to be yet. So we'll just spend a little time and get this all divided so we can delineate all the structures well before we get closer to the tumor. Yep.
I might need the longer to okay now.
Before you go further, have a feel of the liver and make sure you don't feel any other lumps or bumps any place. See what that thing feels like on the right. You can feel it on the right upper.
Just like it says on the
Feel anything else? Is that one?
No.
Anything on the left lobe? But sometimes the imaging will miss lesions in the liver, and you always have to make sure before you put someone through a big procedure that there's no disease that you don't know about. Because certainly taking this tumor out, if she had lots of tumor in her liver, wouldn't really help her very much.
Soon. T-man is 5 hours and counting.
Give or take.
Give or take.
I'm gonna fall asleep and just see how many hours can tick by.
So there are no lesions in the liver other than that one we saw, so we can go ahead. If she had lots of lesions in her liver, we wouldn't carry on. So it's a good first step here. That's kidney. This is going to be all tumor here. Okay, so now we have the tumor. All the vessels have been pretty much all of them exposed. So we're going to start going up the edge of the inferior vena cava on the right side. And we'll start with taking out, we'll kind of take the tumor as it comes and take out the kidney. And then we'll see where we're at. If we can just get one area above it, we'll be all set. We have to get above it, otherwise it's going to bleed like stink. The hardest part is just, if we get above the IVC but below the hepatic veins, then we can just clamp the whole thing and just come across it very quickly and not have to worry about a lot of bleeding. That's kidney. This is going to be all tumor here. So we got above the vena cava sheath and below the liver, so worst comes to worst, we may just clamp off the blood return from the kidney. Now we're going to try and do the hard part.
I guess. How's things going?
She's doing great.
Yeah.
She's doing great.
Everything's going well?
Yeah, the anesthetist going beautifully. Dr. Gerso seems very happy
Yeah.
with how things are going, and they're just taking their time and doing a good job.
Good.
Questions, guys?
No, our question was, how are things going?
Yeah, she's doing beautifully. It looks like things are going to probably take a good part of the day.
Yeah.
So
We've been a team since the beginning, so we do keep.
How old are the other kids?
Nick is 13 and Katie's 4.
Okay. Yeah.
See, Katie's the one most nervous because she had a brain tumor removed last year. And they took out a quarter of her brain, so she knows all about the surgery thing, and she was like, "Oh, you'll be okay, Christine, you'll be okay."
Oh, man, what you guys have been through.
Can I ask you a really warped question?
Sure.
Is there a possibility of seeing the tumor?
That's the first in my career, but let me ask him.
Yeah.
If you want to see it, we'll do our best to.
I'm just curious to see
Just
what
makes
we've
it-
been fighting
Just
with
makes it real, eh?
Yeah.
Sure. Okay. Let me see if I can swing that for you. I'm happy to do that. Okay. Great.
Peter's still working away. They're still working away on her.
Whatever you want to
But
do.
she's doing
Yeah,
awesome.
let's do that. Because there's a teriyaki place in there, and
Tell me when are
there's
they going to
subs,
start?
and there's a couple
Oh,
of
it'll be still a while yet, sweetie. She's sleeping now. She's not feeling anything, don't worry.
Going great. No, we have no. I'm going to give you. This is the piece number 1.
Oh.
And then I'll give you piece number 2.
Oh.
Okay, here's specimen number 1.
Kidney, right kidney and tumor. This is the right kidney and tumor? Okay. Is there any way that you can see it in the vascular piece? She really wants to see it.
Does she want to see a piece of it?
Yeah.
Sure, you could. Do you mind taking and showing it to her?
Yeah.
She wants to actually.
She really wants to see it. She
Up
has
close and
to-
personal.
She has to see it.
Why don't we'll give it to you in a bucket.
Okay.
I just explained to her it's the kidney
Yeah.
plus tumor around it, and there's a second piece coming with it.
Okay.
So what you're going to see is the kidney that they took out and the tumor that's around it. Okay. So these are the strings, of course, that they used to sort of detach it, right? So we're going
Okay.
Where's the tumor? So this is sort of where the brown part is where they burnt it. But usually this is sort of like where the smooth part of the kidney. And that's tumor around
That's
it.
tumor.
That's what you're fighting.
That's the hassle, eh?
That's the hassle.
You're out of there.
Right. Okay.
See you later.
So what we're going to do now, we're going to take that up to pathology. There's more that they're going to take out, but with this out, they're going to have a little more room
More room to work.
to move.
To work. Okay.
Okay.
Good.
Okay. So that's it. So we're going to
That's
send
it.
it up to pathology. Any questions?
No.
So it should be much better
That's
without
the thorn in our sides for us,
Exactly.
really.
Exactly.
Good.
Okay.
It makes me really happy.
Yeah.
It does.
Good. Okay. Well, I'm glad we were able to do that for you.
Right on.
We don't usually like to take out tumors in pieces. You like to just take out one big chunk, but
I don't know how else to get this kind of tumor out because it wraps around the vessels so much. It's just not safe to do it any other way. I think this is the hard part where we're stuck.
Christine has been in surgery for 7 hours. Doctors now face the difficult challenge of removing remaining tumor attached to her vena cava.
Really stuck there. Not giving much of a break here.
Damage to the vena cava could be fatal. But removing as much of the tumor as possible may be Christine's best hope for survival in her 3-year battle against cancer. On the next episode of Life's Little Miracles, Christine's struggle with cancer continues, and Trevor's heart